here in Uganda.
That's right.
I had a surgical procedure, so that puts me out from having any kind of balloon procedure.
Oh, okay.
So there are some conditions you have to qualify for before you can get this procedure done.
All right. Do you mind throwing a little bit more light on those conditions for
so if you've had
those
any
that
kind
could
of
be watching?
abdominal surgery, so we know people who've got weight issues will talk about bariatric surgery, so they've had gastric sleeve or gastric band. Now I've had the band before, long time ago. I lost quite a lot of weight on it, but because I've had that surgical procedure, which was also done in the operating theater under anesthesia, so the risks were there, I'm not able to do it. If you suffer from a hiatus hernia, you'd know about it. If you have a lot of heartburn, ulcers, active ulcers, those are the conditions. And obviously pregnancy, we cannot do it if you're pregnant or planning to be pregnant.
Okay. Now many Ugandans, of course, do grapple with obesity. This one I'll be very brutal about it. We cannot hide away from it. There was a time, 3 months ago, I was told I was obese. Simply because the BMI calculation showed that I actually was, but I didn't think I was. 115 kilograms at the time for a 6'5" man was kind of acceptable. But before you seek treatment that is technologically advanced as this, the intragastric balloon, and what can somebody do before things get out of hand?
See, with the obesity and weight gain, you've got the issues of diabetes, blood pressure, and obviously these are chronic, lifelong conditions which require medication and have their own complications. So for the healthier lifestyle, there's the simple things. Calorie deficit, what we talk, if you want to lose weight, your intake, what you eat, has to be less than your output, your metabolic rate. So I have patients who say they are fasting or skipping meals. Now what happens there? The body digests the muscle, not the fat. So when you're in a weight loss program, we recommend regular intake of food, but in reduced quantities. Don't skip a meal. Exercise, obviously 10,000 steps. We all hear you do 10,000 steps a day. It's very important. That helps increase your metabolic rate. So you start spending your fat as an energy source. In terms of meals, avoid a reduction in the carbohydrates and the dense carbohydrates in particular. So here we've got this habit of having chapati, coke. I mean, I've been through that myself. The mandazis and all that. So the big carbohydrates are no-no. Diet full of green vegetables and protein, chicken, fish, fantastic, and not fried. Avoid the fried foods. These are simple things that have to be repeated over and over. It's something you know, but you need somebody to tell you. And then the alcohol consumption.
And it requires a little bit of discipline. Alcohol consumption, no. A
reduction. I mean, we also want to enjoy a bit of life. So I mean, I can't advocate that, but yes, it's not ideal in a weight loss program.
The Ugandan would be very hard pressed to take in that, especially when it comes to a little bit of party there. Now, when you talk about the procedure for intergastric balloon, when things go wrong, what are the remedies? A balloon being inserted in your stomach has the possibility of deflating. When that happens,
well, with this program, if it deflates itself, the beauty of it, the contents of inside the balloon are like water. It's a patented product by the company Allurion. So if it does spill into the contents of your stomach, it just leaks out. The capsule automatically at 16 weeks after it's been there, the capsule that holds the balloon disintegrates and you pass it out in your stool. So it's a very safe. That's the novel thing about this procedure. It's not anything that has too many side effects. Yes, there's the nausea and heartburn initially when you put it in, but let me talk about our local experience. In Kenya, I think we've had to take out one balloon in the last 3 years, but that was because of psychiatric issues in the patient rather than anything else. It's a very safe thing. If at all you need to get it taken out, you can have it taken out endoscopically. Again, they put you to sleep to take it out, but again, that is virtually unheard of. We've had people at the age of 75 or even 81-year-old having it done. That's how safe it is. You're awake during having it done. 15-minute procedure in the hospital with an X-ray facility to make sure it's in the correct place. And once you tolerate it, it's there. It dissolves itself at 16 weeks. If it dissolves before that, Allurion have a guarantee, a 90-day guarantee, that they will replace it for free.
So across Uganda, you've talked of Kenya, meaning you have a wide footprint in Kenya. How about in Uganda?
We've just started Allurion. I mean, these are samples right now. We're still trying to explain to patients, have the understanding around it, and then once we go through all the rigorous processes, once we get the patients and the demand, then it's available.
All right. There is something that is always very important that we cannot negate in Uganda cost of health?
Cost, well, the Allurion balloon in Kenya, for example, prices vary between $5,500 to $6,500. We've discussed with the company in East Africa, and they've given us in Uganda we can start it at $4,500.
$4,500.
So it sounds costly, but for a lifelong healthy condition, mind you, after 16 weeks when the balloon dissolves, and studies have shown that by 1 year, 95% of the weight you've lost has gone. You alluded to earlier about the stomach being a muscle, and it expands over time. We've been eating and everything. So once the balloon and you've lost weight, the muscle comes back to its normal size. Like a stomach is about the size of a fist. Now, after that, if you abuse it again and you keep eating, you will stretch it up. But if you listen to your stomach and the fulfillment and learn what is the good amount of food, it'll be good.
Interesting there, because people out there have a lot of issues with stomachs. Within the African context, sometimes the bigger the stomach, the wealthier the man.
Well, that is there culturally, however, but it comes with all the complications of diabetes, blood pressure, and the life expectancy also comes down.
Okay. With regard to access, since Allurion and the company that is putting this out is pretty new in the country, how does somebody find the technology? And if they want to get on board, how quickly can it be done?
Well, to look at the information, the website Allurion, Allurion, allurion.com.
Allurion.com.
Or I'm the agent here. You can contact me at 0758 232 889, or come to our clinic at Forest Mall. There's Refined Skin and Body Clinic. We have a website also. So you can go to our website, call that number 0758 232 889. In terms of getting on board, you come in, we do an initial consultation to make sure you're eligible. Actually, the website also has the eligibility criteria.
Yeah,
These days technology has
I was just going to ask you to take us through a little bit more on eligibility criteria, because somebody out there will struggle to understand.
So we talked about age.
Why they need
age. 16, 18 years old, minimum age, nothing younger than that.
Before that, we don't consider
it. No previous abdominal surgery. I mean, people say, what if I had a cesarean section? That is not strictly an abdominal surgery.
Yeah,
abdominal being the stomach itself, inside the stomach gland.
Okay.
So weight loss surgery before, active ulcers, hiatus hernia, which is where the stomach contents come up through the diaphragm. That is a condition that somebody has it, they know. And then very importantly, body mass index, we talked about it, over 27.
Over 27.
You have to be on the overweight category. Below 27 is still safe.
Still safe.
And you'd lose 10 to 15% of your body weight. And you can lose more provided you do the activities and exercises with it. If you just expect to put the balloon and sit back at home and expect to lose the weight, yes, 10 to 15% you will lose. But you can lose more if you continue the exercises.
Okay.
So there's very few exclusions. Most people can tolerate it.
Yeah.
And it's a fantastically safe procedure.
Okay, across Kenya, I'll be very interested in knowing exactly how the success stories have been. You talked about how many in a year?
Well, I know the counterparts there, they do about, I would say 80 to 100 a month across Kenya. And it's been there for a while, so several thousand has been there. And like I said, one case that I've been informed where they took the balloon out was because of psychiatric issues.
Psychiatric issues, not
the client had an eating disorder before, which was not properly picked up. So that can be a problem.
That can be one.
But apart from that, very, very safe. There was one patient I was told about who's had it 3 times, who does it year on year, because it dissolves after 16 weeks. And then the patient doesn't want to undergo weight loss surgery, the invasive procedures. So after a year, got it put in again because they want to keep losing more and more.
Okay.
That's safe.
Let me just return very briefly before we close this conversation on the issue of cost. Your target mainly are people who can afford the technology and the treatment. However, even among those that can afford, sometimes it's pretty difficult. Yes. In Uganda, we have tendencies where many people are simply one treatment away from going broke. I do not know whether there is an arrangement that allows for a huge discount that is embedded within corporate social responsibility?
Not that we have it, but it's something we can explore with the corporates. In terms of payment, we allow your payment plan. There's some upfront payment that has to be made, say about half of it, 50%. Balance can be paid over sort of 3 months. We can agree on that. But what we urge people is that it's the technology in it. You can get, like I told you, the balloon where they put you to sleep and put it in without the swelling. That can be done for as little as, say, 3-4 million shillings. But then you've got the risks of the anesthesia and all that. By the time you're considering the balloon as a weight loss procedure, you've probably tried all your
you've tried the exercise and it has not
so
done.
If you've got that habit of the excess food intake, the alcohol, the sedentary lifestyle, consider this as a change towards a healthier, longer living you. It keeps you healthier and safer for longer. So it's all relative. Cost is relative, I would say. It's your life, your health, and your health as well, we say.
All right, Dr. Chirag Kotesha, your very last words on this.
Well, if you've got any issues with weight loss, start soon. You don't have to consider the balloon straight away. Healthier life, exercise, and dietary restrictions is the initial way to go. That's simple ways to do it without spending the money.
That's right.
So watch your food, and you may not need to go for this.
All right, thank you very much, Dr. Chirag Kotesha, a specialist, and of course taking us through what is described as intra-gastric balloon procedure, the latest in a series of tech innovations in healthcare. That will do it for our Tech Note discussion, but do stay with us. Our Kickstarter will be coming up straight up. A dance hall from slave ship to ghetto, influence of dancehall music in the ghetto, and how dancehall music is transforming ghetto talents. Well, that's it. You're gonna have to look out for it. For those that have to straighten